The Rutland Regional Medical Center is making a conscious effort to provide a better experience for patients. The emergency department is now under new leadership and making strides to deliver compassionate, attentive, and diligent care. No one ever expects an emergency room visit. Hearts sink when the noise of DART, the ambulance helicopter, flies into or out of the area. The doctors, nurses, and techs in Rutland Regional's emergency department know this feeling more than most. On any given day, they see dozens of patients. Some come in for the common cold or flu, others have minor injuries, and some critical. The emergency department here has been plagued in the past with long waits and unhappy patients. The tide is turning, however, under the guidance of two key players, Medical Director Dr. Todd Gregory and RN Thomas Rounds, Director of Day-to-Day Operations in the department.
Our patients, I think, are feeling now that we see them as people who are in need not only of, as I mentioned, the latest technology or procedure, but a hand to hold or whatever reassurance to help them get through a tough time. So it's made a big difference for them.
Dr. Gregory has been a member of the hospital for 6 years. Arriving fresh off his residency, Gregory says he was surprised at the level of care and quality of medicine Rutland Regional was doing upon his arrival. Since he says the technology continues to advance, and with that the little things have to be refocused, such as communication with patients and a friendly bedside manner.
And in the emergency department, that's particularly important. Nobody comes here for an elective procedure. It's all an emergency, and big or small, it's scary. And so what we've tried to do is identify that, recognize that the patients that we take care of are our coworkers, our family members, or our friends' family members, and deliver the kind of care that we would want our families to get.
That may seem like a simple concept, but when the beds are full, communication and attentiveness to all patients can slide. That's what the emergency department is working hard to overcome.
Because when you're resuscitating a child in one room and you have a heart attack in the other, it can be very easy to forget that you have somebody's grandma who has a broken leg, but she's scared and her leg hurts and she wants to know what's going on. So you have to take the time to talk with them. And so that's one thing that we've really focused, and that's at all levels, not just the physicians, not just the nurses, although obviously they're important, but also our technician staff and our secretaries. So everybody's playing a role in that. And we also have a great volunteer group here that's really helped us because they can kind of move from room to room and patient to patient without being tied down quite so much.
Registered nurse Thomas Rounds heads up day-to-day operations in the ED. Retired from serving decades in the Navy aboard submarines and at Guantanamo Bay, Rounds brings with him trauma experience and knows how to be a team leader.
I mean, we've provided great care here, but I joined this team with a goal of making this the best ED in New England. And emergency departments, all over are doing things to try to make improvements. But I think we have the best mix of physicians. We have a great group, and I know you met Todd Gregory, Physician of the Year for the hospital. Just an impressive group of physicians, nurses, technicians, secretaries, all working together and getting the support of administration. I just think it's a new day at Rutland.
Neither Rounds nor Dr. Gregory promise a flawless visit, but both do swear their hardworking staff is committed to providing the best care possible and are striving for excellence.
Yeah, I think I would like to get a message out to the community that, we're working hard. We have a long way to go, and we're not perfect, but we really do care about the folks in our community. We want to make sure that, they know no one ever really wants to come to the emergency department, but we want to know that when they come here, they know they're going to get good care. They know their family members are going to get excellent care, and that we're going to take great care of them and get them through a tough time.